Men, breast cancer and hereditary cancer. Although male breast cancer is rare, about 1 in 1,000 men, 0.1%, will develop breast cancer during his lifetime. This cancer can develop at any age, but the average age of a male breast cancer diagnosis is approximately 60 to 65 years of age. Most cancers are caused by a combination of factors, including environment, lifestyle, and genetics. About 20% of men, or 1 in 5 who develop breast cancer, have a family history of the disease. About 8% of men with breast cancer are carriers of a BRCA pathogenic variant. This proportion is higher among men of Ashkenazi Jewish descent. Other genes may be associated with an increased risk of male breast cancer. The exact risks are not known at this time, but the information will become available in the future. For more information on this subject, please visit the Quebec Breast Cancer Foundation website. Breast cancer develops in the same way in men as in women. It is important for men to quickly report any changes in their breasts to their physician. Many men are hesitant to discuss the signs and symptoms with their physician, and this delay can lead to diagnosis at an advanced stage of the disease. The most common sign of breast cancer in men is a painless lump, usually near or under the nipple. Other signs and symptoms may be discharge or bleeding from the nipple, a nipple that suddenly points inward, inverted nipple, pain or swelling in the breast, a mass in the armpit, an open lesion, ulcer on the skin of the breast that does not heal. Any man with breast cancer should be referred for genetic counseling to determine if he would benefit from genetic testing. Knowing your genetic status is important for 2 reasons. The probability of passing this pathogenic variant to each of your children is 1 in 2, 50%. Children who are carriers will have a higher risk of cancer. They may consider genetic testing when they reach adulthood. Men who are carriers of a pathogenic variant have a higher risk of certain cancers, including breast, prostate, and other cancers. These risks have implications for screening and treatment. Early detection of cancer makes treatment easier and improves the chances of survival. For example, for certain genes, the lifetime risk of breast cancer can be as high as 10%, and the risk of prostate cancer can be as high as 15 to 25%. Prostate cancer tends to occur at a younger age and can be more aggressive than prostate cancer in men without a genetic predisposition. A male carrier should be screened for prostate and breast cancer at an earlier age than men with average risk factors. For example, the National Comprehensive Cancer Network recommends that men with BRCA mutations begin breast observation and annual clinical breast exams by a physician at age 35. It also recommends starting prostate cancer screening at age 40. It should be noted that not all individuals carrying a pathogenic variant in one of these genes will develop cancer. For specific information on genes associated with breast cancer, please visit the Quebec Breast Cancer Foundation website.